This topic is commonly misunderstood, poorly explained, and frequently tested. Today, I'll explain cancer of the breast in a simple, logical, and clinical way so you understand it, remember it, and apply it in exams and real patients. By the end of this video, you know exactly how to approach breast cancer with confidence. Let's start by understanding what's normal, then we'll see what goes wrong. The normal breast is made up of ducts and lobules supported by connective tissue. Breast cancer occurs when cells, most commonly in the ducts, begin to divide uncontrollably, invade surrounding tissue, and potentially spread to lymph nodes and distant organs. The most common type is ductal carcinoma. Second most common is lobular carcinoma. How does breast cancer present? The common symptoms are painless breast lump, which is most common, skin dimpling, also known as pudorrange, nipple retraction, bloody nipple discharge, axillary lymph nodes. So each time you think of the presentation, think lump knots, lump, ulceration, mastitis like skin, pudorrange, nipple retraction, axillary nodes, discharge, and skin fixation. Types of breast cancer. We have ductal carcinoma in situ, that's DCIS, which is non-invasive. We have invasive ductal carcinoma, which is most common. We have invasive lobular carcinoma, and finally inflammatory breast cancer, which is aggressive but rare. Let's move to the risk factors. If you want to remember the risk factors, you think of BRCA late. First is BRCA1/BRCA2 mutation, radiation exposure, childlessness/late first pregnancy, age, risk increases with age, late menopause, alcohol, taking estrogen, that's HRT, early menarche. These factors increase estrogen exposure or genetic instability. Hence, increased exposure in estrogen or genetic instability will increase the risk of breast cancer. So, how do you make diagnosis of breast cancer? Breast cancer diagnosis is based on the triple assessment technique, CIR. That's clinical examination, which involves imaging, which involves the use of mammography with or without an ultrasound, representation, which could be biopsy, FNAC, or core biopsy. Diagnosis is never based on imaging alone. So, how do you stage breast cancer? Breast cancer is staged using the TNM system: tumor size, lymph nodes, and metastasis. Staging determines treatment and prognosis. So let's move to the management of breast cancer. First is surgery, that's lupectomy, which is a breast conserving surgery, mastectomy, and sentinel lymph node biopsy. Next is chemotherapy, which could be neoadjuvant or adjuvant. C is radiotherapy. And finally, we have hormonal therapy, which involves the use of tamoxifen and aromatase inhibitors. Management is multidisciplinary and stage dependent. So, what are the prognostic factors? First is the tumor size. Next is lymph node involvement, which is most important. The histological grade, hormone receptor status, that's estrogen, progesterone, and HAR2.